Good afternoon, everyone, and thank you for being here. Imagine if 500,000 Americans were to lose their lives this year. That would be a shocking tragedy. Yet, this is the number of people who will face financial devastation due to our current healthcare system in the United States. Once hailed as the best, our healthcare system now leaves millions uninsured and underinsured, forcing families to choose between essential medical care and other basic needs. Universal healthcare is not just a dream, it is a necessity for a healthier, more equitable future. With over 30 million Americans uninsured and countless others underinsured, the constant threat of financial ruin due to medical expenses looms large. Medical debt is the leading cause of bankruptcy in our country, making universal health care both a moral imperative and a practical solution to these pressing issues. The bar graph illustrates the widespread impact of healthcare related financial issues in the United States, showing that 30 million Americans are uninsured, 50 million Americans are underinsured, 100 million Americans are dealing with medical debt right now, 500,000 Americans have filed for bankruptcy due to medical debt, and there's another 275 million Americans who are insured but are not free from financial strain due to medical expenses, emphasizing the need for a more accessible and affordable healthcare system. Universal healthcare as a moral imperative. Universal healthcare guarantees that everyone has access to medical services regardless of their financial situation. This reduces health disparities among socioeconomic groups and ensures that all citizens receive the care they need. According to the World Health Organization, this means that whether you are wealthy or struggling financially, you have the same access to quality health care. This system promotes social justice by reducing financial strain on families and preventing these medical bankruptcies. It allows families to allocate resources for other essential needs, such as education, housing, and food. A healthier population also supports a more equitable society. The blue bar here for universal healthcare countries reaches 100%, indicating full access to healthcare for all people, while the red bar represents the United States and shows 85% healthcare utilization, meaning that only 85% of the population has access to healthcare. Universal healthcare is a practical solution. Universal healthcare addresses the inefficiencies in our current system by streamlining the administrative process and reducing costs. For example, countries like Canada provide comprehensive care to all residents without the financial burden, delivering better healthcare results at a reduced cost. Universal healthcare also improves efficiency by reducing the complexity of billing and insurance paperwork, lowering administrative costs for healthcare providers. Additionally, bulk purchasing of medications and medical supplies allows governments to negotiate for better prices, reducing the overall healthcare spending cost. Studies have shown that countries with universal healthcare systems often achieve better health outcomes at lower costs compared to the United States. This chart shows that Canada achieves prominent levels of benefits such as streamlined administrative processes, reduced cost, comprehensive medical care, and better healthcare outcomes than the United States. And the United States does achieve these, just to a lesser extent, highlighting the potential advantages of adopting the universal healthcare model. Now, universal healthcare has some criticism, so we're going to address some of those criticisms now. According to pro and con, and these are the realities. Long wait times. Evidence shows that waiting times are not significantly longer in countries with universal healthcare. Many countries with universal healthcare actually have shorter waiting times for certain procedures compared to the U.S. An emphasis on preventative care reduces the need for emergency services, alleviating pressure on healthcare systems. Universal healthcare systems maintain lofty standards of care. Patient satisfaction is often higher than in countries with universal healthcare. Patients report higher satisfaction with their healthcare services because they receive timely and effective care. Studies have shown that universal healthcare systems can deliver high-quality care without compromising patient outcomes. Many critics also argue that funding universal healthcare would require a significant tax increase. They worry that higher taxes could burden individuals and businesses, potentially slowing the economic growth. However, proponents counter that the overall savings from reduced healthcare costs, improved public health, could offset this tax increase. This chart shows that universal healthcare systems have shorter waiting times, higher quality of care, and a moderate tax increase from 0.7% to 0.5% for the United States, and a lower healthcare debt for universal healthcare countries of 0.2% to a 1 compared to the United States, as you can see here, highlighting the differences in these aspects of the two systems. Now is the time for us to act. We cannot stand by while millions of our fellow Americans suffer due to a broken healthcare system. Universal healthcare is not just a dream, it is a necessity. It is a moral and practical solution that will ensure every person in our country has access to the medical care they need and deserve. This is how we can make this change happen. We can advocate for policy change by reaching out to representatives and urging them to support universal healthcare policies. Your voice matters, and elected officials need to hear from their constituents, which is you. Join local advocacy groups. Get involved with these organizations that are working towards healthcare reform. These groups provide resources, organize events, mobilize communities, all to push for change. You can also help by spreading awareness and educating your friends, family, and community about the importance of universal healthcare. Use social media, author articles, and participate in discussions to raise awareness. You can also support candidates who prioritize healthcare. You vote for and support political candidates that advocate for universal healthcare because your vote can help to elect leaders committed to making healthcare accessible for everyone. Lastly, you can participate in public debates by joining rallies, marches, and other public demonstrations to show your support for universal healthcare. A collective action can amplify our message and draw attention to the cause. Together, we can build a healthcare system that reflects our values and ensures a healthier, more equitable future for all. Let us make universal healthcare a reality. Thank you very much for your time. We will now open the